Welcome to The Explainer. Today we're talking about heart health. We're going to break down the most effective, science-backed ways to protect your heart for the long haul. Let's cut through all the noise and get right to a clear, actionable playbook.
So get this. Cardiovascular disease is the #1 cause of death and illness globally. But this isn't just some dry statistic. It's a reality that touches millions and millions of lives. In the U.S. alone, we're talking about a cost of over $200 billion a year in healthcare and lost work time. That's huge.
But what if I told you the most powerful tool to prevent it is already in your hands? Seriously, the latest research is crystal clear. Simple, consistent choices you make every day are your absolute best defense. This is all about shifting our mindset from, being scared of heart disease to feeling empowered to do something about it.
All right, so over the next few minutes, we're going to walk through this 5-part playbook. First, we'll look at the top health threat. Then, we'll talk about fueling and moving your body, mastering your mind, and quitting smoking for good. And finally, we'll cover why you need to know your numbers. Let's kick things off by really understanding the threat.
Okay, let's jump right in. Section 1. What are we really up against when we talk about cardiovascular disease?
Okay, the specific condition we're really zoning in on here is a bit of a mouthful. It's called atherosclerotic cardiovascular disease, or ASCVD for short. Now, what's important to get is that this is a really sneaky process. It happens silently over many, many years as plaque builds up in your arteries. And that buildup is what eventually leads to a higher risk of heart attack or stroke. And this really brings us to a core idea from the experts, the American College of Cardiology and the American Heart Association. They say, the most important way to prevent atherosclerotic vascular disease, heart failure, and atrial fibrillation is to promote a healthy lifestyle throughout life. This isn't just some casual suggestion, folks. It's their #1 message. Prevention isn't something you do at the last minute. It's a strategy for your entire life.
All right, so that's the what. Now, let's get into the how. Our next section is all about building on that core idea, starting with the fuel you put into your body. When it comes to heart-healthy diets, two of the big ones you always hear about are the DASH and Mediterranean diets. And they're both fantastic. As you can see here, they're pretty similar. But there is one key difference. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is laser-focused on lowering blood pressure. And it does that by being really strict about limiting sodium.
But look, you don't have to get bogged down memorizing a specific diet plan. The core idea, the one the experts really push, is actually pretty simple. It's all about building your plate around whole foods, veggies, fruits, whole grains. Then you minimize the processed stuff, like processed meats and sugary drinks. And one thing to just completely avoid, trans fats.
Of course, what you eat is only half the battle, right? How we spend the rest of our day is just as important. And this is, it's kind of shocking. The average American is sitting down, not moving, for almost 8 hours a day. And that's on top of the time we spend sleeping. It's a huge chunk of our lives. So what's the magic number to fight back against all that sitting? It's 150. 150 minutes a week. That's the goal for what they call moderate intensity exercise. A good rule of thumb, it's any activity where you can still hold a conversation, but you probably couldn't belt out your favorite song. Think a brisk walk. That's the sweet spot that's been shown to seriously cut your risk. And here's the best part. You don't have to suddenly become a marathon runner or a gym fanatic. This isn't about crazy intensity. It's all about consistency. Things like brisk walking, but also ballroom dancing, a good active yoga class, even just some recreational swimming, it all counts towards that 150-minute goal. Okay, so we've covered diet and exercise, but beyond those, there are these powerful, invisible forces at play. And that brings us to our third section, the incredible connection between your mind and your heart.
We tend to put mental health in one box and physical health in another. But the research is piling up, and it's showing that they are completely intertwined. Things like chronic stress and bad sleep, they aren't just bad moods. They have real, measurable physical effects on your heart.
Let's quantify that. A major study actually looked at this, and the results are pretty eye-opening. For example, people dealing with significant work stress had over 3 times the odds of having a major cardiovascular event. And you could see other big ones here too, like a history of trauma or social isolation. These are not small things. They are major, major risk factors.
So what can we do about this? Well, one of the absolute best places to start is with your sleep. And improving it doesn't have to be this huge, complicated thing. It really boils down to a few simple habits. 1. Stay active during the day. 2, create a solid routine, a consistent bedtime in a dark, quiet room. And 3, and this is the tough one for a lot of us, disconnect from your phone and other screens before you try to go to sleep. Okay, let's move on to what might be the single biggest win you can get for your heart health. Seriously, this one is a game changer.
Just look at this number, -44%. That number represents a massive, massive opportunity for anyone who smokes to take back control of their health. Let me tell you what it means.
That's right. It's the reduction in major cardiovascular events after quitting smoking. A huge international study found that if you quit, even after you've been diagnosed with heart disease, you slash your risk of a future heart attack or death by almost half. It doesn't matter how long you've smoked. The minute you quit, the benefits start, and they are profound.
And this chart illustrates a really critical point the research uncovered. Just cutting back? Well, it doesn't really work. The data is so clear on this. The only way to get that significant benefit, that huge drop in risk, is to quit completely. Trying to just reduce how much you smoke, it has a minimal impact. It really seems to be an all-or-nothing deal.
Okay, for our final section, let's talk about not going it alone. Because all of these lifestyle changes are so much more effective when you're working as a team with your doctor. Okay, I know this looks super complicated, and it is. It's actually a flowchart that doctors use, but you don't need to get lost in the details. The most important part for you to see is this section right here, the risk enhancers. This shows that your doctor is looking at so much more than just your cholesterol numbers. They're factoring in your family history, other conditions like kidney or inflammatory diseases, all sorts of things. This is how they create a prevention plan that's actually personalized for you, not just some generic advice.
So let's bring it all together. Here's your prevention playbook. The bottom line is this. Preventing heart disease isn't about finding one magic bullet. It's not about some crazy, extreme lifestyle overhaul. It's about combining these manageable, scientifically backed choices that, when you put them all together, create a really powerful defense for your heart.
Listen, this isn't about waking up tomorrow and changing everything about your life. That's not realistic. This is a journey. And you know what the most important step on any journey is? It's the first one. So, after everything we've just talked about, what's the one small change you're going to start with today?